Liz Diemer is Vice President of Community Fundraising at the Michael J. Fox Foundation for Parkinson's Research. She joined the foundation in May of 2013, but developed a passion for the Parkinson's community as a college student when participating in the Pancakes for Parkinson's events. Liz oversees the foundation's grassroots community fundraising arm and works tirelessly with her team to engage a global network of members who fundraise for the foundation through unique fundraising events, athletic feats, and online campaigns. As Vice President of Philanthropy, Veronique Enos Kaefer develops and implements strategies to engage the Parkinson's community in the foundation's priority calls to action to help speed a cure for Parkinson's disease. Veronique joined the foundation in March of 2001, shortly after its inception. She works closely with individuals living with PD and their loved ones, and is deeply committed to the community and to the Michael J. Fox Foundation's mission. Liz and Veronique, welcome to PD Wise. It's such a pleasure to have you both with us today. Look forward to our conversation.
Oh, me too. I'm excited to talk about this topic and for everything that you're doing on PD Wise. It's such a beautiful resource.
Thank you. Thank you. Well, let's start with your connection to Parkinson's disease. When did you become connected to PD and the PD community, and what attracts you most to the work you're doing?
I'll jump in first. So first and foremost, I've been lucky to be on staff at the Fox Foundation for the last 9 years. But I've actually been involved with the Fox Foundation as a Team Fox community fundraiser for the last 15, which is kind of crazy to think. I actually don't have a personal tie or family tie to Parkinson's, but through my involvement over the many, many years that I've had the good fortune of being part of this family, I have had the opportunity to meet countless families, many of whom have become very, very close friends. And ultimately, they are my why. They are why I look forward to getting up and going to the office every day, logging on to my computer, wherever that may be from, and really diving into whatever the day has ahead. It's hard, almost impossible to pick, I think, just one thing that attracts me to this work and what's kept me here for so long. But I think the overarching thing that I continue to come back to is the inspiration that I get in seeing how people and communities and families and organizations show up to be part of this work, and how they truly believe and ultimately are a very, very important part of the puzzle that will help to cure Parkinson's. It's incredible, and I know we're going to have a lot of time to dive into some of the examples of what that looks like, but for me, it's the people, and I'm very, very lucky to be part of this work as a result.
Great, thank you.
Yeah, and for me, so I joined the foundation when it was a couple of months old, so back in the early 2001, and I was looking for, I wanted to make a difference. I wanted to be part of an organization that could actually do what it was setting out to do. And pretty early on, I got some clues watching what Debbie Brooks, the co-founder of the organization, was doing, that this was going to happen, and that has just built like the evidence that we are going to accomplish our mission, which is to find better treatments and a cure for Parkinson's disease. It is happening. It has been happening for the last 20 years. I didn't, when I joined the organization, didn't then know someone with Parkinson's, but I did know people with chronic illnesses. And I had a question mark. I'd been working in mental health, and I had a question mark of, do I want to become a therapist working for people with mental health? I ultimately didn't do that. I ultimately found so much just potential and reward and real results through the Fox Foundation. And similar to Liz, so I also have worked with the community this whole time, and it's an incredible group of people. And I don't know whether that's because when we live with a chronic illness, there's a certain we have to make sense of it in a way, and so it brings out, that part of people that, like, when they're finding meaning, they do a lot of giving back and diving in and making things count. And that has been incredible. Like Liz, I love this community and now know thousands of people with Parkinson's. I'm just so grateful that I've had a chance to be part of it.
Yeah, well, I appreciate both of your responses. And, as someone who works in the mental health field as a professor in the School of Social Work who trains folks, a lot of whom will become therapists, let me assure you that what both of you do is highly therapeutic and really brings healing to a large group of people around the world. So really, really appreciate what both of you do. And I think of it in terms of really therapeutic in more ways than maybe you realize. But let's talk about the work of the foundation. For those who may not be as familiar, what do you do? What is your reach? What's your mission? All of that.
So the Michael J. Fox Foundation, so our mission is to find better treatments and a cure for Parkinson's disease. And I think that was really born out of need. I don't want to speak for Michael, but I think he just wanted to help in whatever way he could. And when he started investigating, he really saw that there was a need to have a kind of a bird's eye view, comprehensive approach to research and to look at everything that was happening, all of the potential. What were our next priorities that would unlock the next doors and make life better for people living with Parkinson's? And it was really research. So that is our fundamental focus. At the same time, we don't get to cures without a community. And we also know that we are a resource. We are a place that people stop when they are diagnosed. They often happen onto our website. So we also want to, it's not the primary piece of our mission, but to provide robust information and resources for people as they need them. So, but yeah, the Fox Foundation, our reach, is global. We fund research globally. We interact with, we have scientific advisors, and we interact with the whole community, the whole research field, setting priorities together and then setting them in motion and funding them. And we've seen amazing results.
And I'll jump in a little bit to talk about some of the work that I have the privilege of doing. But I think, one really important note is that from MJFF's early days, right? So we were founded in 2000, and right off the bat, we were oftentimes getting questions of what more can I do? This work is important. This mission is inspiring. Where can I plug in? And people were eager to support that work, but naturally so, there was a limit to perhaps personal philanthropic giving that people could make. And we understand that. We were grateful for every last penny that we received, certainly, but we knew that people were eager to do more. And so we saw folks getting really creative. We saw individuals signing up to run the New York City Marathon, or perhaps they were gathering friends in a local bar and hosting a charity happy hour, which turned into a guest bartending competition. There were bake sales and comedy nights, and people were finding ways to transform their personal passions and their expertise and to bring their network into our work through community-led fundraisers. So in 2006, the foundation formalized what is now known as Team Fox, which is our grassroots community fundraising program. That's a very long-winded way of saying tons and tons of events are happening around the world that benefit us annually. And if you fast forward to 2022, right now, we are unbelievably lucky to have over 8,000 individuals who annually join us to participate in events, to host one-off campaigns of their own, and to find creative outlets to engage, as I said, their personal networks. To date, this group of exceptionally creative and dedicated individuals has actually collectively raised over $110 million. And as you can imagine, that is having an enormous impact on the work that we're doing. The foundation at large since 2000 has funded over $1.5 billion of research globally, but that 110 million that's been raised through Team Fox, personally, I think is really special, right? These are folks who are perhaps, a granddaughter hosting a bake sale at the end of her driveway in honor of her grandmother, right? And she might only raise $100 that day, but that's going directly to this work. And on the flip side, as you can imagine, there are some pretty big events that have had the chance to really grow over the tenure of this program and are hitting significant milestones. So just as a point of comparison, our largest Team Fox event is the New England Parkinson's Ride. And this year they will be hosting their 15th annual event this September, and they're expected to be crossing the $9 million mark for historic funds raised. So we are seeing events all across the spectrum, but it's really at the heart. It's families, it's individuals, it's people coming in saying, how can I continue to be part of that puzzle piece, right? That's going to bring our ultimate goal of a cure across the finish line. And I get goosebumps talking about it, but this is why I come to work every day, right? You never know what's going to be in your inbox at 9 a.m. when you wake up, and there's oftentimes just new events that you would have never imagined that ultimately go on to just break new barriers and crush new milestones. So I also just wanted to note that.
Yeah, I mean, hearing those numbers is just, mind-boggling. And, as someone who, early on, once I became public about my diagnosis after about a year of not being public about it, I went to a Fox event, and, the community piece cannot be overemphasized, because I felt, for one of the first times in my experience, I felt like I wasn't alone, and I made really lifelong friendships that continue, to this day, very, very close friendships that were, started at a gathering of the Fox Foundation, and have participated in a lot of Team Fox events, and will continue to do that. I love the model for a lot of reasons, but one is for exactly the reasons you say, Liz. It really brings together all kinds of folks who may not have any connection with Parkinson's, and then they're hooked, and then they become, passionate team members and community members who are contributing in lots of ways. So really, really love all of that. But let's talk about some of the foundation's successes that you're most proud of. I mean, the work is substantive. It is moving the needle. I know that. But tell folks about some of that success.
So I'll start. When I joined the foundation, it was a time when we had dopamine replacement therapies. So I think everyone listening will know, but in Parkinson's disease, the cells that make dopamine in the substantia nigra that are in charge of movement there are struggling to make it. And so we had levodopa and other therapies. But there wasn't a lot else in terms of treating, like, as you all know, everyone knows here, there's more than just those motor symptoms. And there were a lot of unmet needs, and there was a lot of potential. Since that time, so we are now a mature organization. The therapeutic development pipeline is full, it's robust. There's hundreds of treatments in clinical trials, not just on one pathway, but on multiple pathways to better treatments, ultimately something that would feel like a cure. And all of that has happened during the time that the Fox Foundation has been working in this field and connecting and collaborating with all of the players. It's a field-wide effort, but we have really played a role in helping to coordinate and facilitate and speed it up, and to point to direct funding and attention to areas that are gaps and unmet needs that have great promise and potential. And the result is now, when we began, we did not fundamentally understand the genetics of Parkinson's. We're still learning a lot about it. For anyone listening who has a question, the conversation is still that genetics isn't driven and determined by a gene, in that, like, if you have a genetic mutation, you have to get PD. But in some people, there is a correlation between a mutation and getting Parkinson's disease. And there seems to be kind of a combination of environmental factors and genetics with predisposers. We have been looking into, even though it's right now, what we know is like less than 10% of people have a mutation that is driving their Parkinson's, but we've been looking at the clues in genetics for lessons in what Parkinson's is. What are the underlying processes? So the treatments that we had when we started were about replacing the thing that's missing, dopamine. Great, we need that, and there have been improvements in how to deliver that. But they weren't about why are the dopamine neurons struggling and what's fundamentally happening at a biological level. We're on the path to discovering that. We have hundreds of treatments that are in clinical trials with the potential to address those particular needs. And we've learned a lot. There are new treatments for people. Individuals are responding better, living better. They're having better quality of life. And I am excited. There's this little protein called alpha-synuclein that is clumping up. And in the majority of the progressive neurological disorders, there is a protein that clumps. For some reason, if you will, garbage disposal system, the system of like ridding the body of the things it's used and doesn't need anymore, isn't working to perfection. And there are a lot of clues. We're collaborating, we're sharing with other disease groups, and we're trying to get to the bottom of it. And we have 17 therapies in human clinical trials, so close to patients with the potential to break down those clumps. And the hope is when you get the gunk out of those cells, they're going to function better, feel better, make more dopamine. And we're not going to stop there. We're going to keep exploring everything we're learning from the genetics of PD. We also have a project to really understand the biology of Parkinson's, why there are differences in how it presents. What's the difference between like someone who's fundamentally tremor dominant or someone who's gait and balance dominant? And, something I'm particularly excited about now. So in the beginning, we really felt like we've got to keep the funding strong. We have to keep the whole therapeutic development pipeline filled. We've got to help chaperone handoffs so that science can get to patients. That is happening, and that has been happening. And now we're in a place where we're really thinking about meeting the patient where they are with their needs. So if you're newly diagnosed, if you're in the middle of your disease, or if your Parkinson's has moved along, you're going to have different needs and you're going to have different symptoms. And we want to be able to treat each symptom and each need of each individual so that it really feels like it's a personalized medicine approach. And now we can say that we're on the path to doing that. And we've also made successes. You just get me started on successes. I don't want to stop, but we've made discoveries in biomarkers, which fundamentally, if we want treatments that are curative to the brain and to those cells, we need to have ways to see that so we can move treatments forward. So I'm excited. Those are just a handful of the things we're doing, but lots of success that keeps us both there. And then I hope that people in the community feel and have a sense of that there's this tremendous momentum, and it has continued. It's continued over the last several years, and it is promising. It's bringing about results. There have been 18 new therapies come to market since 2014, and that's huge for the lives of people living with PD.
Well, and I'll jump in just to share a little bit about how we're seeing that progress come to be. When you talk a little bit about kind of what's unique about the Fox Foundation, first of all, we are the only kind of PD organization out there that's 100% laser focused on research, which I think is really important. Yeah. But when we also were founded in 2000, we flipped the script on what it meant to be a research-based organization, in the sense that we weren't just fundraising and then pushing money out to the experts. Michael and his co-founder, Debbie Brooks, now our CEO, really wanted to ensure that there was an opportunity for us to be monitoring that progress and to be bringing the experts out of the field and into our doors. And so, the way that we fund that, V and I are not research scientists. I do not have my PhD, but we're able to talk so eloquently hopefully about these things because we sit side by side experts, right? We sit side by side individuals who have spent their careers behind the bench, who have studied Parkinson's, who are movement disorder specialists themselves. These folks are our colleagues sitting inside of our offices, who are helping to determine and to designate where the funds that Veronique and I work hard to raise ultimately go. And the way that we then issue those funds is the very unique model of kind of de-risking the field, right? So we work hard to figure out where the high impact, but also the high risk, high reward opportunities are that are out in the field that we feel have a good opportunity to be a significant shot on goal. And by kind of putting more shots on goal out into the universe, our goal ultimately is to make some of these projects really attractive to the pharmaceutical companies or to the government that have a lot higher funds than we do, to be able to say, hey, this is an opportunity that we think could really go the distance. And so by us de-risking that strategy, by providing early seed funding, moving something through the early stages of testing, our hope is to then make it really attractive to some of the other funders who can then bring it across the goal line. And so that's how we've been able to really move that needle quickly, right? Over the last 22 years, the fact that we've been able to see so much progress, so many therapies moving through ultimately to shelves that patients can have access to is unprecedented. And it has also transformed the way that a lot of our peer organizations have thought about their funding models too, which I think ultimately everybody wins, right? We want patients across the board to win. We want families who are working through these challenges to win. And so we're certainly glad to see that in the Parkinson's space, but it's been inspiring to see it happen in other spaces too.
Yeah, and as one who, pays pretty close attention to the research and to the funding mechanisms, I think, the Fox Foundation is unique and really a sort of trailblazer in expediting the research and the funding mechanism so that, folks who are living on a clock, people like me and many others in the community can, feel a real sense of urgency, not only in themselves, but on the part of people who are really working 24/7 to, find better treatments and ultimately a cure for this disease. So good on all of you for that. I really, really appreciate you articulating that so well. So let's look ahead for, say the next 10 years, given what you've done and what you're doing. Where's the energy? What are the priorities and the strategies as you try to fulfill Michael's vision of working to put yourselves out of business?
Well, to keep this momentum going, and it's not just one path, but it's many, and I'll talk about a few. So we talked a bit about what's happening with trying to get alpha-synuclein broken down and out of those cells. So we will keep working on that, as well as all of the other genetic pathways and what they teach us and how to individually treat them. Because as we explore treatments for a particular genetic mutation, we often find that the processes involved affect everybody with Parkinson's. So there's a chance for new therapies there. We have just, so 10 years ago, we started a project called the Parkinson's Progression Markers Initiative. So it's a biomarker study. At the time, we felt that we didn't have enough measures of what's happening within the body when there are changes due to Parkinson's disease. Measures like that are helpful at diagnosis, of course, but they're helpful as the disease progresses, and then really helpful, and this is what I care about. If you have a good treatment that's going to reverse the disease, we want markers that are going to show it. So we, for a decade, have been gathering samples and data, and it's been going well. And we have now tripled the study and are moving into a phase that I find is particularly exciting, which is what are the early pre-symptomatic, pre-diagnosis markers of Parkinson's disease that could be preventative down the road. So any of the other preventative screenings that we get in our lives, could we go and be screened for Parkinson's, and could we stop it before it starts? So we are currently recruiting individuals who are at risk for Parkinson's disease. Perhaps they have a close relative, a sibling, a child, a parent who has Parkinson's. As we know, siblings, children, and parents shouldn't be concerned that they're going to get Parkinson's because it is sporadic, but they can play a valuable role in helping us, because there may be measures of protection as well. Why does one person get Parkinson's and another doesn't if there's some genetic relationship? Also, people with REM sleep disorder and people who know they have a genetic mutation that is correlated with Parkinson's, but they don't have the disease, they can be very helpful. So we're looking at prevention, which is just amazing that we're there and that we can start working on that. We are going to continue and will not stop looking for ways to slow and stop Parkinson's disease. And there's multiple approaches. We're even still, stem cells are even still in the game. What's interesting is when I began, I thought stem cells potentially could be a curative treatment, but it's a funny thing. If you have a treatment that gives you the life you want to live and you can do everything you want to do, then that's a cure, even if there are processes still in motion. But with stem cells, it would be replacing fresh, healthy cells, but they would still be subject to the environment that was causing Parkinson's. The fishbowl analogy of, like, if you replace goldfish in a bowl, but the water needs to be cleaned, those goldfish would get sick too. So, but we are working on cleaning up that water so that stem cells could be another way of goldfish. We are improving working to improve symptomatic therapy. So there are projects in place for improving deep brain stimulation, which is a good therapy for many, a therapy that's available now. But we're trying to, or scientists are trying to make a deep brain stimulation that is smarter, that's kind of activated when you need it, and that is kind of responding to your body in real time. When I ask scientists, my understanding is that a cure for Parkinson's may be kind of a cocktail or a combination of approaches. And so we'll be working on all of those. The other thing I want to say is that treatments, there are good treatments for addressing Parkinson's symptoms now. But as you know, over time, like the levodopa therapies are good. The dopamine agonists are good. But over time, our body responds less well to them. So it's not that that the drugs are working less well. It's that they're interacting with the cells, and the cells are furthering along in their Parkinson's disease. We're really interested in helping individuals who have advanced Parkinson's to be able to live the quality of life they want to live, and any unmet needs that are non-motor. So cognitive changes, dyskinesias, there've been new therapies to help improve dyskinesias, but we're still working on those. So we want to address every unmet need and slow or stop the progression of the disease. And that's all. But I know that we will actually accomplish a lot of those things over the course of these 10 years. If the last 20 years are any indication of the speed and the momentum, and it just keeps going, I think that there is absolutely reason to hope that we will have therapies to slow the disease, to break down the alpha-synuclein clumps, and that we'll find markers, early stages, to start treating it earlier.
Yeah, that's so encouraging. Just a couple of quick thoughts. It's amazing to me how many people I meet who are on the Parkinson's journey and at different places in the journey. And they say something like, if we could find a way to stop progression where I am now, that's a win. I mean, sure, we'd like to be able to reverse the disease process. And I hear you saying, I hear lots of other smart people saying that's within reach. But even to arrest the sort of progression would be a huge win. And it's amazing to me how many folks, again, who are at different stages of living with this disease say, I would take that in a heartbeat, So I think that's really, really important to recognize and to point out. And, I hear a lot of really well-informed, accomplished people like yourselves and people in the scientific arm of your foundation and others say, there's really reason to be hopeful, that not 25 years from now, but, less than 10 years from now, we could be looking at really game-changing therapies, both on the symptom management side, but also on the disease altering side. So I want to really, underscore what you just said, Veronique, because I think the community benefits from hearing that, because it's really true.
Well, and I'll jump in to say, I know for those who have been in our Fox Foundation orbit for quite some time, or even just for the last year or so, you oftentimes hear the pipeline is exploding. And we don't get tired of saying that, and it continues to be true, right? And I think just when we feel like we've seen that new horizon, a whole swath of new therapies do come in, and it continues to just get more and more robust. So I'll echo what you said, Ellen, for sure. But I also think it's important to note that, while we certainly are maintaining that steadfast focus on research, the foundation, especially in the last couple of years, has also really made it a priority to ensure that we're continuing to meet patients where they are. So when we're talking about kind of what we see in the journey ahead, this is part of it. And this goes to your point, Alan, around recognizing that everybody is at a different stage of their Parkinson's journey, but also acknowledging that one person's experience with Parkinson's is one person's unique experience with Parkinson's. And the more that we can continue to educate each other, the larger community, to allow folks to find comfort in recognizing that their unique experience still fits within this ecosystem, the more that we can kind of strengthen the fabric of that Parkinson's community. And so one just quick thing that I'll note is over the last couple of years, we've really invested in creating a wonderful platform called the Parkinson's Buddy Network. It's an online platform that was designed for the Parkinson's community to connect on shared interests and topics. There's a bunch of free resources that are also provided, things like guides and webinars and all sorts of things. But it's an opportunity for folks to engage in meaningful connections, to share their experience. And it allows us to also help in combating some of those challenges of isolation within Parkinson's, and certainly within the last 2 years as the COVID-19 pandemic has continued to challenge us all in unique ways. It's also a space for loved ones and for friends and supporters and caregivers to also be part of those conversations and to find opportunities to connect. So the point is, regardless of whether you're in Texas or New Jersey or California or Oklahoma, you can be connected in a space where you can share what's going on with you. You can connect with someone who might be able to share some, best practices or advice, or just be a buddy. We know how important that is. And so when we're thinking about kind of where there's room on the horizon to continue to grow, it's strengthening that Parkinson's community, allowing folks to feel empowered and connected to where they are and also where they could ultimately be.
Yeah, I really appreciate that. And especially your mention of care partners and family members. As we all know, Parkinson's is not an individual disease, it's a family and a community disease. And resources are available through Fox and other networks for support for those folks as well. So you mentioned the Buddy Network, really excited about that. What are some other ways that people can get involved in the work of the foundation?
Well, we love this question because there's so many ways to get involved. One of the things that I think also is a success of the foundation is how engaged we've been in trying to elevate the patient voice in research. We have individuals being involved in research, whether it's just educating their support groups and their communities that like your voice literally counts, and getting patients involved every step of the way. So if an individual wants to be involved in research, there are different ways to do it. There are ways to be involved in clinical trials directly and in observational trials. So there are a few studies that I'll point to right now. One of them is the Parkinson's Progression Markers Initiative. We talked about that earlier. You can go to the website, type in PPMI and get started there if you think you could be, if you think you would like to contribute to that study. There's another study though that, how people with Parkinson's really often say like, I'm an expert in my disease. This has got to be valuable somehow. But his disease is different and his disease is different. But there's got to be someone in Ohio that has a Parkinson's that looks like me. And so there is a way actually to gather big data and all of those main themes and your expertise of your particular version of Parkinson's and have it be valuable to science in setting priorities and at looking at themes and at looking at gaps and unmet needs. It's called Fox Insight. It's basically you can fill out surveys every 90 days about your experience with Parkinson's. Care partners, family members can do it too. And that's a really useful way. And you don't change your medication regime, but you can also be in traditional studies. And there is a tool to make it easier to do that called Fox Trial Finder. You log in your version of Parkinson's, your particular timing of when you were diagnosed, how far you would travel, what you're willing to do. And then it should generate a list for you of studies you could potentially be candidate for. And then you reach out to the trial coordinator to take it further from there. We're also always grateful for the passion and the commitment and the funding that individuals who are philanthropic and who want to give direct towards the research effort, and we're forever grateful for that. It allows us to move this mission forward. And then the work that you do in your own communities, teaching others, encouraging others, being an expert for others, helping guide them. I mean, we don't have chapters across the country, though we want to be reachable from anywhere. But I think the community acts as that in many ways. And then education is another way to get involved, because a smart community, which this is, is an engaged community and a hopeful community, because there's so much in there. As you start to unpack it, you're like, oh, there are many reasons to hope. So we have a lot of resources there for education, Third Thursday webinars, podcasts, just so many resources on the website, and those lists are growing every day. Particular guides for specific aspects of Parkinson's disease. So encourage you to do those things. And then there's more. And Liz, I think you'd be the perfect person to talk about community involvement.
Well, it's probably no surprise that I'll jump on the Team Fox bandwagon one more time. But, for folks who are interested in doing something a little more, or finding an opportunity to bring their loved ones, their networks, their colleagues in together, fundraising is a great option through Team Fox. And there's a number of ways you can do that. As I mentioned earlier on, no matter what your passion is, no matter what your time commitment or level of expertise is, there's a place for you here at Team Fox. And so I encourage you to take a look, teamfox.org. There's lots of opportunities to join events that already exist. So there's no need to feel the burden of planning something, although certainly the sky's the limit, and we've got a staff who's here to coach you kind of through that process. But the foundation also hosts a Run Walk 5K series, which is one of my favorites. We're thrilled to finally be back in person after a 2-year hiatus. We've already kicked off in Los Angeles and Chicago. We're going to be hosting a virtual event over Father's Day weekend this coming June, and then we'll be hitting the road again in the fall. So certainly take a look there, runwalk.michaeljfox.org. And I think the other thing outside of fundraising, just to note, is advocacy. We haven't talked a lot about that today, but it continues to be a growing priority for our community engagement. We've expanded our footprint in Washington in recent years, knowing that public policy remains such a critical piece of solving that Parkinson's puzzle. It's important for us and for the community to help policymakers really understand what matters to people living with Parkinson's. And I have to applaud you, Alan, and everyone on the PBY's platform, because sharing your personal stories is such an enormous part of that. It's important that we're able to kind of share with Washington the unique aspects of Parkinson's and why it continues to need to be a critical priority. And through your being able to do that, you're able to really help shape the legislation that ultimately affects the entire community. So grassroots advocacy is fantastic. It's how we get that done. I encourage folks listening in to explore signing up for MJFF's policy updates and action alerts. It's a great way to kind of get updates directly into your inbox when there's an opportunity to take a role either at your city or state or local level. And it's a nice way also to stay up to date with what's going on. There's been a great momentum in recent years with creating a Parkinson's registry across the country. States are doing this kind of at a local level. And the goal here is to be able to showcase the prevalence of Parkinson's. We can continue to have it be a priority for the NIH, also for government, and certainly for other organizations that are able to advocate for kind of expediting some of additional funding and research priorities. So advocacy is a great way to also dive in.
Yeah, I couldn't agree with you more. Really, really happy you mentioned that last piece in particular, Liz. We all have a voice, and collectively we have a lot of influence and even power if we use those voices in constructive ways. And whether it's from the funding side or the environmental side, which is more and more evidence that environmental factors play a key role in getting Parkinson's disease. We all have a voice, locally and nationally, with trying to shape that policy and change the game on that front too. Just want to say one other thing, harking back to what you said earlier, Veronique. One of the things that struck me, most profoundly about the Fox Foundation community is the fact that you have world-renowned researchers and clinicians who are literally at events, sitting at tables with patients and really listening to them on a deep level to understand their own experience, because the disease is so heterogeneous. There's a lot of commonality, of course, and we want to focus on that, but it's also different for different people. And one of my big passions is helping healthcare providers not only recognize that, but really to make the deep investment ongoing in listening to the wide-ranging voices of those who live with this disease, so that they can be more informed on the research side, but also on the clinical side as well. So thank you for that. What's a question that I should ask you that I haven't asked you?
Well, I don't know if this is a question, but it's something I want to speak to, which is that as people are newly diagnosed and as they're navigating Parkinson's, those first 2 years, I think, from observation from what people tell me, they can be some of the more challenging years with PD. You're figuring out what medications work, you're figuring out what this means. And so I just want to say, like, we're talking a lot about like getting engaged and trying to provide some hope for what happens. But I also just want to put a plug in for taking care of oneself, building a care team. So movement disorder specialists are neurologists that specialize in Parkinson's and other movement disorders. It's a good idea to have a movement disorder specialist on your team of physicians, and other needs that might come across. Exercise is medicine for people with Parkinson's. It helps growth factors that help regenerate cells, helps them to be produced in the brain, and then just doing the things that you believe in. Like, so many times people say, like, this has helped me focus on what matters to me, my family, carving out more time for them, or for the things I want to do, and for the people I love. And I just, perhaps it's unrelated to what we've been talking about a little bit. It's not about research, but I just encourage everyone to live the life they want to live with Parkinson's disease, to dive deeply into that even more than ever. We're going to be working hard right here to try and make that easier and easier from a medication support standpoint, or slow the disease down. But I learn from this community all the time about the importance of living in the now, in appreciating what's here, and trying to live my very best life. So I'm just putting a plug in for building your personal community for Parkinson's, for yourself and for your care and for this next chapter.
Yeah, I really, really appreciate that. I think you're absolutely right. For most of us, the first year or two can be the most difficult and the most disorienting time of living with this disease. And really, I mean, speaking personally, feeling, really alone in this sort of journey, particularly in the beginning. We don't have to be, as I learned, and as many learned, but we often isolate ourselves and don't really know where to go for resources and for community. I mean, one of the great things about my involvement with PDYs is I have the privilege of talking with people pretty regularly who are just getting on the road and who are terrified and who are not yet informed. And so I just really want to underscore again what you've said about that self-care and that sort of surrounding yourself with people who want to support you and can support you. The other thing I want to say, we're sort of coming to the end here, but just on a personal note, I often tell people that no one wants Parkinson's disease, but to your point earlier, Veronique, there are many joys and wonderful experiences, in my experience, that come with being part of a community of people who have Parkinson's and who are working on behalf of people with Parkinson's. And no group of people has been more meaningful to me than the Michael J. Fox Foundation. I mean that, and both early on and where I am now, 5.5 years after diagnosis, it continues to be a source of great strength and hope, and meaning and fun. Don't want to lose that too. It's really a fun community, and we take Parkinson's very seriously, but we don't take ourselves all that seriously all the time. And to your point about living your best life and focusing on today is my way of putting it. I think it's important to hear that from people who don't have Parkinson's, but who are working on behalf of those who do, as well as those of us who live with the disease. So that's my long way of saying thank you to both of you for who you are and what you do, and all your colleagues at the foundation. It makes a tremendous difference, not only in research, but in the quality of life for more people than I can count. So thank you.
Thank you,
Thank
Ellen.
you.
I also just want to give you a huge shout out. It's been incredible, the number of people that have come to us looking for a resource that we have had the opportunity to pass along to PDYs. And in the same way that we oftentimes hear that the Fox Foundation is one of the first stops that people make along their Parkinson's journey, I do think that what you have built has also become one of those very critical stops. And I think it's a safe space for people to be able to see the many different dynamics and lived experiences and voices and faces of what Parkinson's looks and sounds like. And that is such a valuable tool to help kind of reduce stigma and create community and comfort, and allow folks to understand how they can fit into what comes next. So we are grateful to be a part of it and grateful to be able to have conversations like these. Thank you for allowing us a space to share a little bit about kind of the work that we do as a broader part of the work that we all are doing.
Well, thank you very much. We deeply appreciate that. And I look forward to having both of you back in the future and talking about the additional progress that's being made by the Fox Foundation and all of its supporters. But thank you so much for your time today.
Thank you, Ellen.